Good afternoon, and I am so glad that we are going to wrap up our COVID series, episode 46, with the man that's I started the series with. For the last 3 years, I called him my Valentine date because it was February 14th, 2020. We started the program, and I try to come back to it on the day of the anniversary. So it's not Valentine. You were so busy traveling, and so we're just still happy that we have this opportunity today. I know there's going to be other developments with COVID and pandemic, but I thought it would be just kind of nice to wrap it up, and also with an in-person program without the Zoom box. And I'm sure that you're all very familiar with Professor Cowling's bio that I don't need to go into. So let's kind of get started. And then I'm going to actually, we already have a lot of questions on Slido, and also those of you in the audience, feel free to ask the questions. But I guess my question, Ben, for you is, in this 3 years, what has surprised you the most about this pandemic? We none of us, we've never seen a 3-year pandemic. I mean, SARS was, less than 6 months? And this is unprecedented. So what has surprised you from your kind of professional vantage point?
There probably lots of things, but one thing that immediately jumps to my mind is the containment that was achieved here and in mainland China and in a few other locations around the world for quite some time. And I've been working on pandemic planning for many years, and on page 1 of the influenza pandemic plan that I wrote for World Health Organization some years ago, on page 1, we said don't spend too much effort on containment because it's too difficult and futile. It won't work. Just mitigate as soon as possible. And then it turns out with the COVID pandemic that's more transmissible than flu, more difficult to stop than flu, we were able to contain for up to 2 years. Not indefinitely, but up to 2 years, which it surprised me that so many parts of the world actually tried to do it. And then it also surprised me that it succeeded so well. I still remember in early 2020 thinking that in the lockdown of Wuhan wouldn't achieve 0 cases. They could get it down, but it would come back again as soon as they relaxed. And I think some of my colleagues even published something in the Lancet, not me, but my colleagues published something in the Lancet saying that kind of thing, that it will go down when you have a lockdown, but once the lockdown's released, it will come up again. And so if you only do that if you're okay with the idea of ups and downs repeatedly.
Right now, I think in reading the newspaper, I guess WHO, they said in about 2 months, they will officially declare the end of the pandemic. But, COVID is still around. And right now, I wanted to ask you about the latest strain, the Arcturus strain, it's kind of making its way here in Hong Kong. Actually, not that many cases, but, kind of exploding in India and other parts of the world. Are you worried about that? And if not, why not?
So not particularly. I think we know that with a virus like COVID, it will continue to evolve, and because there's such a lot of immunity now in Hong Kong and elsewhere in the world, the virus will find a way that it can still continue to cause infections. So this is just the latest evolution in that pattern. So Arcturus will cause a lot of infections around the world, but I don't think they're going to be generally severe compared to the past. Now COVID is becoming a milder and milder infection because of the immunity that's been built up. So there will be problems for vulnerable groups, older people, particularly those living in long-term care, because any infection, even a mild infection, can trigger all sorts of other consequences which are not good. But in terms of public health as a whole, I think we may have more to fear from influenza at the moment than from XBB.1.16, which some people call Arcturus.
I don't know who comes up with these names.
I think some guy just comes up with the names and then they stick. It's not WHO, and they made they're not very happy with the naming, but then they don't have a sexy name, so they just give numbers which no one can remember. So I think with,
Yeah,
with the
I would love
name,
to
you
know
can
where this
remember
name
it.
came from,
Right.
and even Omicron. I mean, the other
Right.
ones you can understand, Delta and all that, but
Yeah.
this one, I will have to look into that.
Yeah.
But one of the things, and you said you're going to be traveling and to international. We're all kind of traveling globally now, thank goodness, with the border opening. So, what are some of the concerns that when you go to these conferences? What are you guys talking about now? What is on your agenda in terms of? Are you looking at who's done better? I mean, evaluating
Oh, of
what's
course. Yep.
Lessons learned, or are
Yep.
you now looking at the next pandemic and so
No, of
on?
course. So in that direction, there's a lot of discussion about what we would do in the next pandemic. And you would have heard in the news about H5N1 cases in Europe, actually quite a lot, and even some human cases popping up, which is a worry. I don't think H5N1 is going to cause a flu pandemic, fingers crossed, at the moment, but who knows when the next flu pandemic would come. And there's a big question about what would be done in such a scenario, because H5N1 can be quite a nasty infection. So, of course, it depends on the severity profile. If it turns out to be mild after it gains the ability to spread in humans, then no big deal. But if it's relatively severe and spreads in humans, we'd have to look back at what was done in COVID and think about which things would we do again. But one of the problems I think that governments will now face is pushback from populations about not again. I've heard some, I think, politicians in the US saying they never want to have a lockdown ever again, right? And so there will be pushback, not only in the US, but in many other places, about the idea of doing more stringent public health measures. And so what we've got to think about now is how can we find measures that will make a difference without having so much of the negative consequences? And that's not easy to identify, because a lot of the most effective measures also have the nastiest side effects. So
I think what you said about U.S. It doesn't surprise me. There's an election year coming out. I just knowing the American public, and it's not just the American public. I think everybody just. I think because this went on for 3 years with all the mask mandate and all of that, I can't imagine the public, any public. I mean, here in Hong Kong, I don't know. Well, if we want to go through, what the how people will feel about it. What do you think?
yeah, I don't know. I mean, to me, the vaccine mandate was a more significant intervention than the mask mandate. I mean, in Hong Kong, you see people still wear masks here even now, and I don't think there was that much opposition to the mandate. There were, you could say, eyebrows raised when masks were mandated in country parks, which is obviously not going to have much effect at all. But in public transport, in high density settings, I don't think there was much opposition to the mask mandate. What I had said repeatedly in the pandemic is I think people would wear masks anyway. So whether you mandate it or not, they'll wear them. So in that sense, the mandate isn't quite needed, but at the same time, it's not something to, that doesn't have a reason. But for vaccine mandates, I think there's pushback on those, and I hope that won't filter down into resistance to other vaccines, which can do a lot of good. We have the childhood vaccines, which we have very good uptake of, but there's other vaccines now. There's HPV vaccine programs in girls in school. There's flu vaccines for people of all ages. There's COVID boosters and so on. So you asked me about what people are talking about. Another big area of discussion is about the boosters. So many people have had 3 doses, 4 doses, some even 5 doses. I think some may even have had 6. I think that's about the number that you could have had the most. But there's now a question about what's next. Do we still have the need for annual boosters? Should it be more frequent than that or less frequent than that? And there's actually not an enormous amount of evidence to go on. We know that the first 2 doses were really important. The 3rd dose also made a notable difference. After that, there's relatively less studies, relatively less evidence, and there's some, I've certainly heard in some of these discussions, the suggestion that further boosters aren't particularly valuable. So that's interesting, because after we've had 3 doses almost mandated, and then a 4th dose pushed with not that high uptake in Hong Kong, but some uptake in other places, to then say that actually there won't be any more boosters would be quite a turnaround.
So you don't think it's going to be like the flu every year? We have to
That's
get
a
our
question.
booster? Yeah,
So for
I
flu,
mean,
it's
I'm
very
curious.
clear that annual boosting is a very sensible strategy. And actually, I have one trial that I've been doing in Hong Kong for more than 5 years, where we'll report in due course, I suspect from the preliminary result, we'll report that having 2 vaccines a year actually makes a lot of sense for older people in Hong Kong, which is interesting because we have flu year round. And so for older people, they could get a autumn booster and a spring booster and be protected better for the whole year because the once annual is designed for temperate locations, Europe and the US and whatnot, where they have one winter flu season every year, and they don't need to worry about protection in the spring or the summer. But we do. So that's why that might change. But for COVID, it looks to me like there's certainly less evidence to say that annual boosting is a good idea. We'll have to see. There'll be more data for sure in the coming months and the coming year.
I remember my first conversation with you, and besides the mask question, I think the one thing you said you were really interested in studying, and it was the COVID on children. And this was February of 2020. And in fact, I think with the latest report from SCMP in the media about children this last 3 years, really, wearing masks, they have not developed healthy immunes, and right now they're worried about the children with flu. So have your study focusing on children, what have you learned, and what are you concerned about in this area? Because the casualty has been the elderly and also the children in some ways.
In some ways, right. So in the first year of the pandemic, children were really clearly at lower risk of COVID. And then the second year as well in Hong Kong, certainly, the virus was changing though. And by the time Omicron appeared, and I think with Delta elsewhere in the world, children suddenly could get infected more easily, and there were cases of severe COVID, but not so many. One thing that's a little bit surprising, perhaps, is the number of severe cases and even deaths we've had with COVID in children in Hong Kong, which hasn't been reported in other parts of the world. And I'm not sure the reasons why, what's special about Hong Kong, and that's something that I'm certainly going to be thinking about a bit more. But with Omicron, in general, it's a little bit milder anyway than some of the other strains. And children are not a high risk. So there's been a lot of infections with COVID in children, but a small number of severe cases, but not nearly as many as the severe cases in older people. But as you mentioned, with the disruption, the school closures for months, I think if you added up the total number of days that schools have been closed in Hong Kong, it would be a large number. I should probably have it in my head, but I don't have it. But it's months, it's not weeks. That's a lot of learning opportunities missed. And for some children, I have 2 children, and one of them is very happy with online learning. He prefers it to the in-person classroom learning. And then the other one is much better with classroom learning in person. They just can't concentrate with the Zoom. So that's a really significant consequence of the school closures. And then, as you mentioned, without the other viruses circulating, now we're in a position in the short term when the community is probably more susceptible to flu and other things. I don't think we'll totally catch up. So many of us have missed infections for 3 years. I don't think we're going to suddenly catch up with 3 years worth of infections. That's not how it works. But there'll certainly be more in the coming months because we've lost some of our immunity and it takes time to get that back. So I'm a little worried about the current flu season. I know that there's some indication from the surveillance data that it might be peaking, but I'm still quite worried that it could go quite a long way further because we haven't had flu for 3 years, and that means we're more susceptible as a community than we would ordinarily be. And the hospitals are already 100% capacity a lot of the time anyway. So whenever there's a surge because of flu or in the past because of COVID, it causes a lot of issues for not only for the patients with flu or COVID, but for other patients as well.
Recently, I learned about from Professor Wood from Oxford about the Oxford Government Response Tracker. And I'm sure you're familiar with that. And I think it's been really, she was saying a lot of the government have been using that to find out, comparing how everybody is dealing with it, kind of learning from each other. And so I'm curious if you, have we learned anything here? I'm just, with Hong Kong, we're always comparing ourselves to Singapore. And I think in the beginning, when Singapore's number went up and we thought, oh, we were sitting there feeling really proud of ourselves, Hong Kong was doing so well, and then fifth wave comes and bite us. And in some ways, overall, from having done this episode 46 times, it seems to me, again, as a layman, Singapore in some ways have done, in terms of response, better than anyone else. I'm not a fan of, it's hard for me to say that, but do you think that's the case? And how do you, right now, I guess the question I want to ask you, and I know some of our people in the audience, is the government, are we going to look at what we've done right and what we've done wrong, and what can we learn from this last 3 years? And what's your personal?
So I think for the first 18 months, not quite 2 years, but first 18 months for sure, we were neck and neck with Singapore. You couldn't say who'd done better and who'd done worse. I still remember early in the pandemic, Singapore had the outbreaks in the dormitories, the workers' dormitories, which was big news, and they weren't really able to stop those. And a lot of workers got infected. And I think, unfortunately, some of those workers died, and they were generally healthy younger adults, and some of them died from COVID, which was quite a shock. But there is one major difference in the approach to vaccines, where in Singapore, the Prime Minister gave a number of press conferences throughout 2021, where he explained that vaccines were going to be the primary defense against COVID fairly soon, and so they were holding back COVID as long as they could, but they wouldn't be able to stop it forever. And they were encouraging, the Prime Minister of Singapore was encouraging everyone to get vaccinated. It was freely available, particularly older people, because they'll get infected sooner or later, and it would be much better for them if they've been vaccinated before they ultimately get infected. And in Hong Kong, the messaging was very different. I think vaccines were seen as a backstop, like a plan B. So plan A was to keep the virus out of the community, and plan B was we have vaccines if the virus gets in. But the problem we then faced is that many older people, I think, with justification, put off vaccination. It wasn't that they were totally against the idea of getting vaccinated. They were not anti-vaccination like you hear about in some parts of the world, where people they just think, that the vaccines have got all sorts of nasty chemicals in them, or nanobots or something, and they just won't even go anywhere near it. In Hong Kong, it was just hesitancy, that they thought they'd better wait, because what's the point to get vaccinated in June of 2021 if we're not going to have any cases for another year? Why not wait until a month or two before Hong Kong reopens, and then that's the optimal time to get vaccinated? And there's a logic to that, but unfortunately we couldn't control the timing. So when COVID did start spreading in January 2022, a lot of older people were caught by surprise, and then it's too late to suddenly go and get vaccinated, because you need 2 doses. You've got to wait between the 2. You've got to wait after the second one for your protection to kick in. So that was really the big difference, in my opinion, between Hong Kong and Singapore. And then if you look at the mortality statistics, Hong Kong was pretty much the lowest COVID mortality per capita in the world in 2020 and 2021. But in 2022, it was the number one, I think, of anywhere in the world in 2022.
Isn't it still?
Still right, because in other parts of the world there haven't been that many deaths. Of course, it's recorded deaths, so some countries don't do as much testing as they used to. But even so, it's a real shame for Hong Kong that we did so well for 2 years, and then in the third year we've gone to the other end of the league table, essentially. And I think a lot of the hard work in keeping the virus out of the community, it was worth it, but it could have been worth so much more if the vaccination rate had been much higher in older people particularly. And if you think about the measures that were taken to boost vaccination rates, things like the mandates, the yum cha requirement for older people, that was later, that was after the fifth wave, that wasn't before. So that was a reaction rather than something that was done in advance of the fifth wave, which was the one with the large number of deaths.
Well, I think what I found interesting is every country or city that's kind of were proud of their record, in a few weeks, they all were bitten in the end, including China, right? Everybody was so proud of their, whether it's vaccination or lockdown or whatever, and then when it happened, it happened. But are you surprised at the way, I personally, I guess, was worried about China. I think all of us here were, when, the China, again, was locked down for, closed for 3 years. And then when it was opening up just a few months ago, we were all worried that we were going to kind of, the brunt of that was going to impact us, but hasn't seemed to happen here. Is that, how do you explain?
Yeah, well,
that?
if you look at the case, we did have a surge when China was having the exit wave. So I think there was some leakage into Hong Kong. We did have, so if we count in the waves, which the government in Hong Kong doesn't do anymore, but if we have fifth wave was March last year, sixth wave was June and July with BA5, the seventh wave was over the new year with leakage from China, with the viruses that they had also causing a lot of infection in Hong Kong. And hospitals were busy at that time with COVID patients. And then now we're having another resurgence, which would be the eighth wave, if you count it in that way. And we're having now probably XBB point something. But there's less awareness globally of the exact strains that are circulating compared to a year or two ago when everyone was being tested and there was a lot more data.
Okay, I remember one of our first talks, you mentioned, and it got me so depressed, I think must have been the first talk, you mentioned possibility of the pandemic lasting 3 years. And I remember afterwards, like, wow, in the beginning when we did the series, we really thought it was going to be like SARS, 6 months, that it was going to be the end. But when you said that, I'm pretty sure it was you, because I was like, 3 years? And I remember this was, 2020, never thinking, oh yeah, he's going to be wrong about that. 3 years later, we're still here. So a lot of what you say, I think we all have, learned a lot. And there are certain things I learned, in talking to the experts, have been, one of the reasons we started the series was because Hong Kong had expertise on SARS. And, we really thought we could share the information with the world. Remember, we were the first to have it, Wuhan aside, but Hong Kong has this, freedom, in terms of sharing the information. So I think for me, having done this 46 episodes and having access to anyone we wanted, no one said no to us, from Nobel laureates to all of the doctors here. I learned more from this as a layman, and I have to say it's from asking stupid questions that I learn and kind of alleviate my own concern. And it's not just my own concern. I think what was great was some of the questions from Slido and all of that. So I really want to kind of commend you and thank all of you for being here and continuing with this series. Even though it's 46, we're actually working with our Paris Center to maybe welcome back Professor Peter Piot, who's now on our Asia Society Paris board. He's no longer in London. I think he's went back to Brussels. So we are going to continue having this type of discussion, but I just feel like we need to formally bid COVID here goodbye, but I think we should continue learning and continue asking questions about this. First time I heard about coronavirus was exactly 30 years ago. This month, I was working in New York for an organization, Committee 100, and we were organizing our annual conference. And remember, that was when Hong Kong was shut down 30 years ago. David Ho was saying he came to Grand Hyatt, and he was the only guest at the Grand Hyatt during SARS. And because, and I remember the visitors, many of the speakers coming from China and Asia could not come. And it was our most successful conference because we had Dr. Alice Huang from California, and that was the first time I've heard of coronavirus. And I can't believe 30 years later, it has played such an important part on all of our lives. It wasn't just Hong Kong this time, it was global. There's not one person that has not been touched in that way. So I hope we've learned from this, and I want to thank you for being there to answer all my stupid questions, but I also thank you all for tuning in, and please stay around and ask more questions, and it's from the discussion that we learn, and the idea was always. Mission of Asia Society is all about learning. It's they're not pointing fingers, but learning, and we are about building bridges of understanding. And I still think there's a lot to learn from this very wily virus. I mean, we read about the the flu of 19. It's not the Spanish. We can't call it Spanish flu anymore, right? The flu of 1918.
That's right.
We certainly learn a lot from that, and I think we globally should learn from this, because, like you said, I think we're going to have another one, unfortunately, and I hope it's going to be a couple of years. I think we need to recover from this one first. But I think another thing I take away from this last 3 years is just our loved ones. I mean, not being able to, here in Hong Kong, we travel, and my family is in the States, and, not being able to see our our loved ones and in the States, when the lockdown happened, many people, I have grandparents who couldn't see their grandkids for over a year. They couldn't hug their family. So I think we have learned a lot from this. But one of the last question I want to ask you is, do you think we underestimated the mental health aspect of it? I think there's been so many scientists involved on, like you, researcher, but I think we somehow underestimated the psychology. I mean, this is what we're hearing now with the kids, the impact of SARS on children and the elderly, and on all of us. So do you think, this is one lesson we've learned, that, we need shrinks as well?
I would say I'm not sure it's a problem of underestimating it. I think it might be a problem of disregarding it. And that's a sad thing to say. But I think in a lot of times, if there was a discussion about whether to do a policy or not, and someone raised their hand and said it's going to have a lot of impact on people's mental health, it would be brushed off as not a major concern. And I think that's very unfortunate, because there's going to be consequences for many years, I think, on people who've suffered in the last 3 years, and it's not something that can be resolved very quickly. So I think that's something we do have to learn for the next pandemic, is if there are going to be, again, social distancing measures and so on, and measures that have economic impact, how can mental health be protected or even promoted, avoiding loneliness and letting people see their families and so on. So that's a big question, and I think that's something we do have to look at. It's something I've certainly talked about myself, but as I say, I do worry that it's disregarded by many people, unfortunately, as not being as a substantial concern.
Well, I want to again thank you, and thank you all for being here. And this is goodbye to this series, and but still tune in. There's going to be some great programs coming up. And I think one of the areas we're going to still continue to focus on is really the area of public health. It's unfortunate that this, I think with the pandemic, in many parts of the world, has been politicized, but I think there is still, issue of public health that we need to learn from it, whether you're, from China, Hong Kong, or the U.S. or Europe. I think we've lost a lot of elderly this last 3 years. And I think in Europe, I remember the beginning when we saw what was happening in Italy and all that. And I think we owe it to those who passed to ask questions and to learn from this lesson. And it's too high a price to pay. So thank you all for being here. And I look forward to seeing you at future Asia Society program, whether in person or via the web. Thank you.